Okay. What we just need to do is, this is the only subjective part of this, is we need to kind of get an area where her heart's going to be just a little bit off the table. So we just kind of need to kind of eyeball. We're going to say her heart is at the 13 level. Okay? So that's going to be our 0 point. Right? So remember 13. What we're going to do is at some point when we're sure that the catheter is still patent, we're going to turn it off to the fluid line. So turn it off to the fluid line.
This is the fluid line?
Mm-hmm. And now you're going to start to see this drop. And this will take maybe a few minutes, but we're going to, and you may see it kind of with the heartbeat, but eventually it will stop. If it's wherever it stops, we're going to take the difference between those two numbers, and that's our CVP. Okay.
Between the numbers
between our
where we
0
think
point,
our
which
heart
is our 0 point is going to be 13 because that's where our heart is. It's going to stop somewhere up here, okay? And we're going to take the difference between those two numbers, and that would be our central venous pressure.
So, what is our CVP measuring? Good. So the pressure in the right atrium.
Okay, so.
So in what cases is this going to be helpful to us?
Cardiac problems.
Yeah. Why?
It's not pumping efficiently, so we need to know.
So more, think about if they
It's not
were,
supposed to
if your
go up.
cardiac
There it
patient
goes,
was
okay.
on fluids, we'd want to make sure, right, fluid overload, right.
Okay,
It also
so
helps in hypovolemic patients, but we always used it for patients who had cardiac disease and that were on IV fluids in the hospital to make sure they weren't getting fluid overloaded.
It looks like it likes to stop around 9.5. Wait, what's the, or no.
5.5.
Yeah, 5.5. Okay. It's going up a little bit, but it likes to go back down to, okay, so, and just to make sure,
How much?
turn it off to the CVP, and we'll just kind of clear the catheter out again, just to make sure. Okay, now turn it off to the fluid, and we'll see if it doesn't move, then that's going to be our line. Okay. Yeah, that's her movement.
Sorry.
So we're going to say, so the difference between 5.5 and 13.
7.5.
So our CVP is,
7.5.
and is that within the range?
Yes.
Yes.
So you're normal.
You got the good CVP.
Yeah.
So then